觀眾，你哋好。咁今日華人叢刊咧就想同大家傾一傾下關於健康咧同埋呢個醫療呢個計劃嚇。咁我係特別好高興咧請到 Donnie Nelson， 佢係一個真係喺呢一個題目係一個專員嚟嘅，係講得好好。咁我請到佢嚟咧就同我哋講一講下關於呢個加州呢個醫療事前指引啦。好多人都唔知道呢一個表格係乜嘢一回事嚇。同埋亦都講唔同嘅健康醫療計劃。呢個對我哋家人、對我哋自己、我哋嘅朋友嘅健康都好有幫助嘅嚇。咁我首先咧就介紹 Donnie Nelson 俾大家認識。咁佢就係喺我哋聖方濟各醫院同埋聖瑪利醫院 （St. Francis Memorial Hospital） 同埋 St. Mary's Medical Centre 做一個專員嘅嚇。咁我請佢自己介紹佢嘅工作俾大家認識。Donnie, I was explaining to our viewers that having you come really as an expert in the subject matter that we're going to discuss is deeply appreciated because the directive, the advance directive is pretty much an unknown in our community, and to have you explain that along with other type of care like palliative care. So thank you very much. Yeah.
Thank you for asking me.
Yeah. So Donnie, first explain your position with the hospitals and how long you've been doing this job.
Okay. Well, I am what you call a certified hospice and palliative care nurse, and I've been doing that for about 10 years. I am the nurse manager of the palliative care department at St. Francis and at St. Mary's in San Francisco.
Okay, let me explain that. 咁啊 ，Donnie 咧就係喺兩間醫院，佢個職位咧就係 nurse manager， 即係一個佢係有執照嚟到做呢個善終同埋呢個舒緩計劃嘅。咁佢係一個護士。啦，佢係一個護士嘅經理嚇，咁佢就係喺聖方濟各聖 Francis 醫院同埋聖瑪利醫院兩間醫院咧都係佢管理嘅。好啦，咁我依家問一問阿 Donnie， 佢話佢做咗呢份工咧已經有10年咁耐嘅嚇。So Donnie, little bit about the importance first of ACP, Advanced Care Planning. First, what is Advanced Care Planning and why is it so important?
Well, my experience has been working in this field is I have a lot of family meetings in the hospital. I work with patients who have advanced illness.
Right.
And a lot of times, you know, patients and their families, they don't necessarily understand what the disease process is. So when they do come into the hospital and they've had a sudden incident where they might have to have a hospital stay, it's very scary. And so sometimes having a plan once you have some kind of health concern, you know, something you might have learned from your primary care doctor, but having a plan about the what-ifs is very important, and we call that advanced care planning.
Okay. Let me explain it. Yeah. 咁啊，Donnie咧就解釋話，我哋話呢個加州呢個醫療事前呢個指示咧係一個法律通過咗好耐㗎啦。咁當年話佢喺醫院嘅時候咧，見到好多病人咧，當佢有一個相當嚴重嘅病症咧嚇，咁如果要住醫院咧，咁對個病人同埋個家人嚟講都係好驚㗎嚇，一件即係有陣時係相當害怕嘅事情發生。咁所以當年話如果你自己同埋你嘅家人有一個計劃，一個預先去接受啲治療嘅醫療啦，但係你已經知道咗自己想點樣做咧，係非常好一件事。係點解咧？因為有咗呢個計劃咧，你哋冇咁驚嚇，咁所以佢覺得做呢個 Advanced Care Planning 咧，我哋叫做 ACP 嚇，呢個加州事前指引嚇係非常非常重要嘅嚇。好啦，咁我問一問阿Donnie 話點樣去同個家人去溝通嚇。So Donnie, when you said that you have many family meetings and you start to meet with patients and their families, our families usually know what their loved ones want and what their loved ones desire when things happen?
Well, for the most part, we don't like to have these discussions. These are hard conversations to have. My experience working with the Chinese community, especially the Cantonese-speaking Chinese community, is we never have these discussions. It's taboo. It's bad luck. And so not having the discussion doesn't necessarily mean that the health issue is going to go away. So sometimes if we can just really talk about what's happening, that can make it a little bit better. But for the most part, I don't ever see that.
Yeah. So your challenge is getting the planning started or getting the conversation started, and how receptive are the patient at that time and the families at that time.
Because it's a very scary topic, we don't talk about it. When I first started doing this, I wasn't really good about how to approach it with people about this thing that's going to happen. And so I think over the years, the skill set I developed along with my team is about how we approach patients and their families of having this discussion. And a lot of times it's more about this thing is happening, how much do you want to know? And just starting with a conversation that doesn't seem so scary, I'm able to go to talk about places, and so that we can talk about the healthcare. And it doesn't seem so scary. It seems supportive. It seems like it's the right thing to do, and then we have a plan.
Very good. Let me explain that. 咁啊，Donnie 話佢當你有一個比較嚴重嘅病症啦，咁然後你又唔知道點樣做咧，咁當時咧係佢自己初去做呢一個工作咧，都係有少少唔係好順利嘅嚇，係因為。尤其是我哋唐人咧係唔中意講呢一個題目嘅，但係唔講咧代表你個病症唔會發生啦，同埋恐怖嘅事情唔會發生嚇。咁所以咧，Donnie嘅意思咧就即係話佢開始咧就係好真誠咁樣同嗰個病人同個家人去傾偈，咁咧就聽下佢哋點樣去處理即係話如果有嚴重嘅事情發生咧，佢哋想點樣做咧，應該點樣做咧咁佢逐漸咧，佢覺得即係呢個題目對個病人同個家人咧都唔係咁困難嘅，咁佢依家覺得即係自己可以有一個方法去同佢哋溝通啊。So Donnie, even for you, it took a while, right, to get to that stage. So from the community perspective, what do you think the community as well as healthcare providers like yourself do to make these type of conversations easier to happen in the home before they come in to become your patients?
I think what we're starting to see now is a push for primary care doctors to have these conversations. Most people find out that they have some kind of chronic illness from the primary care physicians. So I think it's important that when we do find out about you got diagnosed with a heart condition, a lung condition, something like that could gradually get worse, now's the time to ask about the what ifs with the doctor. And a lot of times when you do come into the hospital, we've already passed that chance. And so it seems to be a bit of a surprise to the children who may not understand what's going on with their parents' health either, or who other people in the family just have no idea what's going on. So the sooner we can start that conversation, the better.
Yeah, very good. 咁啊，Donnie咧亦都話未入醫院之前咧，如果你同你個家庭醫生講下你自己嘅健康嘅情況，如果個家庭醫生話你可能係有心臟病啊，或者糖尿病啊，或者其他嘅慢性疾病咧，咁你就要開始去同你個家庭醫生去商量一下話。咁第日如果真係有嚴重嘅情形發生咧，咁應該點樣做咧？應該點樣去處理？做啲乜嘢嘅醫療咧？咁呢個Donnie話最好都係同個家庭醫生開始呢個 conversation 呢個傾偈嘅形式去問下佢呢啲題目，又諗一諗你自己點樣處理咧？咁嚇，咁呢個係非常非常好嘅提示嚟㗎嚇。Donnie, these are just so helpful, really, from the family and from the patient perspective, that it's something that you need to do, and don't worry about it. Just start the conversation, ask your PCP, and then think about it, right? So all
Absolutely.
that is just very important. We're going to take a short break, and when we come back, I'm going to ask you to explain what is all these different types of care.
Okay.
咁各位觀眾，我哋再一陣間翻嚟咧 ，Donnie Nelson 係我哋今日嘅真係 expert 嚇，咁我哋會問佢去解釋其他呢啲醫療嘅方法嘅。 咁今日咧，各位觀眾，我哋同 Donnie Nelson 咧就講緊關於呢個 ACP 咧，我哋叫做呢個事前醫療嘅指引啦嚇，同埋好多唔同依家喺醫院咧都可以接受唔同嘅服務嘅。咁你聽到 Donnie 話佢喺聖瑪利同埋聖方濟各醫院咧做咗有10年呢一個特別嘅工作，咁我依家就請佢解釋乜嘢係 palliative care 嚇，因為佢係呢個 palliative care 嘅主任嚟嘅嚇。So Donnie, let's go through a little bit explanation from you. So what is palliative care and how is that different from hospice care and home health care?
So it's often a misunderstood topic, as we know, but the term palliative means to ease suffering. And so I think too often it gets likened to just end of life. However, the way that we like to, or the way we practice palliative care is that when a person has a chronic to terminal illness at some point, what we can do is we can come in and we can help, do education about the disease process, what to expect, what kind of medications, also help with symptoms if you have anything like that, but then also just to come up with a plan about the what ifs. At some point, if you end up in the hospital, what can you expect? A lot of my patients feel very grateful and say that they find the support and the education about that important. Now, when we talk about hospice, hospice is a little bit different. It's a part of palliative care, but it's not all palliative care. Hospice is a time when maybe a person has an illness and they're no longer able to get any kind of treatment for it. It's not getting better. Or the person might say, I'm doing all this treatment and the treatment's actually causing me more suffering and I don't want to do this anymore. And they might have a period of time that they have left that they want to focus on being comfortable. At that time, we can work with a hospice agency or a team that can come out and they can follow a patient into the home, they can follow a patient into a skilled nursing facility, and then kind of just be a support not only to the patient but also to the family while they go through this process. A term that we don't like to use in any culture is dying.
Yeah.
And so when this thing is happening, making a plan of how would you want that to be instead of it just happening and a lot of things are taken out of your control. With hospice, you're able to do that. And then hopefully in palliative care, we can make a plan way early on before you get to hospice. Now, home health is a little bit different. A lot of times people will come into the hospital and they get a little bit deconditioned, meaning it's difficult to walk, it's difficult to move around at home, do these things that they normally would do that they don't think about. So the home health can come home to follow a patient to the home. Sometimes it's a nurse, sometimes it's a social worker, help with medications, help with appointments, and then also we do physical therapy, occupational therapy, those kinds of things that are in the home where a patient is getting a little bit better and we can get them at home and get them back to what they were.
Very good. That explains the three. Yeah. So 阿 Donnie 咧就話，如果你喺醫院咧，咁你好多時都聽到話啊，咁我出院嘅時候咧，會有啲乜嘢服務咧咁所以首先咧就解釋 palliative care。palliative care 嗰個英文咧個解釋就係話舒緩嚇，舒緩乜嘢咧？就舒緩你即係唔好咁辛苦，令到你唔好咁辛苦。咁所以佢話 palliative care 咧唔係。啲人以為話，如果我俾 palliative care 俾呢個舒緩計劃你咧，你就係慢慢就會死亡㗎啦。佢唔係 end of life 嘅，即係嗰個係唔同㗎嚇。咁佢但係 palliative care 咧就可以。即係同個病人或者同佢嘅家人咧解釋一下，即係喺呢個情形，如果你有嚴重嘅病症咧，係點樣去處理咧？有啲咩醫療咧？如果第日真係要入醫院咧，你喺醫院嗰度有接受一啲乜嘢嘅醫療係對你自己嚟最好嘅？咁呢個就係舒緩計劃。咁佢 hospice 咧就係善終計劃。嗱 hospice 咧就係話，如果你嗰個病症係食好多藥，有好多呢個醫療計劃都冇用㗎啦。咁你係知道一個短期內咧幾個月就或者係會面臨死亡咁咧就你亦都唔想話繼續去食好多藥啊，做好多 treatment 啊咁樣。咁呢個咧 善終計劃咧就可以一係喺屋企啦，咁有醫生啦，同埋有護士啦，同埋有其他嘅服務係幫助你去度過呢一個好艱難嘅時期嘅嚇。咁然後 home health care 咧就係呢個家護嘅計劃咧，就多啲人認識嘅，即係話譬如你喺醫院譬如你有心臟病嚇，或者有中風，咁你個行動唔方便，咁你出院嘅時候咧，或者你喺療養院咧，咁當年話你可以申請呢個 home care 或者 home health care， 咁佢就會派護士啦、物理治療 PT 啦、職業治療 OT 啦，同埋呢個家護嘅計劃去幫助你6個至8個禮拜去恢復你個健康嘅狀況嘅。咁呢個咧就係 home care 嚇，咁即係3種唔同嘅接受嘅醫療嘅計劃嚇。So that's great. That's very, very clear. So, Donnie, does every hospital in the Bay Area or in San Francisco have a person like you that counsels and talk to family and patients and explain to them just like how you explain to us?
I believe that there's supposed to be a Joint Commission mandate that all hospitals that have a certain amount of beds have to have some kind of palliative care program. I don't want to misspeak, but I believe that every hospital in San Francisco proper does have one. And
yeah.
I think so in the Bay Area as well. I think other parts of the country, maybe not.
And at which point do the palliative care team or coordinator go talk to the patient and the family? Do they have to make special requests for this service?
Well, palliative care is practiced different, I think, a little bit in different organizations. Because I'm in a smaller community hospital, I usually I'm aware of most of the patients that come in, and I get consults on that. However, I do believe that if you go into any hospital and you feel like you could benefit from somebody to be an extra level of support, and you're with a loved one, or you yourself or the patient have a chronic to terminal illness, is you can always ask for a palliative care consult, and if there's a team there, they should come seek you out.
Okay.
Yes.
All right, good. Donnie 咧就話佢相信三藩市嘅醫院咧冚唪唥都有一個呢個舒緩計劃一個主任，即係好似 Donnie 呢個護士長呢一個 position 嘅。但係如果係佢自己咧，就每一個病人入到嚟聖 Francis Hospital 咧，佢都識得嘅。咁係如果佢真係覺得嗰個病人或者個家人有咁需要咧，佢自己就會去同佢哋傾下偈，講即係答佢哋啲問題。但係如果你啲家人同埋個病人覺得係仲需要多啲深入去了解呢個舒緩或者善終或者呢個家護計劃咧，咁你可以要求嗰個醫院派佢哋啲特別嘅人士同你哋傾偈嘅嚇。咁佢相信係每一間醫院都會咁樣做嘅嚇。咁我依家問一問阿 Donnie 話COVID 咧有冇影響到我哋嘅醫院送啲病人翻屋企嗰個計劃嘅？Donnie, sometimes you are being asked, used to be discharge planning is very thorough, and patients and the family know exactly when the patient go home what they need to do, right? But now, did the pandemic, did it change somewhat the discharge planning function?
Well, COVID as we all know, had a huge impact on all of healthcare in a certain kind of way. And I think one of the biggest impacts is, we stopped letting people into the hospital for a while. What we're starting to see because of that is we just don't have enough healthcare workers kind of here at the moment. As far as the discharge planning process goes, it sometimes can take a little bit longer, just because we're trying to find the correct services for people to utilize. But now that we're opening back up, we want families to come back into the hospital. We want to do training, we want to do education, so that when patients go home, they have that little piece. So I'm starting to see that come back to like it was before the pandemic.
Yeah. Because sometimes at the community level, people bring in their stacks of discharge planning papers, but we say, did someone explain, what you need to do? And they say, no, they just give it to us to discharge. Yeah. So I'm glad that this is
we're hoping
going
that
back
we're going
to
to see
normal.
a change.
Yeah. Very good. 咁Donnie咧就話，以前咧個 discharge planning， 即係話個病人離開個醫院翻屋企之前咧，佢一定有個護士坐低同佢哋，或者有個社工坐低同佢哋講下話嗱，你第日翻到屋企咧，你要 點樣做咁嘅。但係因為 Covid 咧，因為個新冠病症咧，就影響到好多家人係當時係唔可以去探病嘅。咁即係話個病人離開個醫院咧，亦都冇家人喺側跟嗰度聽住，即係點樣處理日後翻屋企嗰個醫療嘅。咁所以，但係依家Donnie咧就話開始咧佢見到冚唪唥家人都開始可以翻入到醫院。但係最大問題咧，佢話最近咧就唔夠護士同埋唔夠嗰啲專員去處理啲病人喺醫院。咁所以如果你係需要即係佢哋嗰啲職員咧係解釋得清楚俾你或者你嘅家人知道，第日翻咗屋企咧係點樣處理咧，你依家可以係去咁樣要求嘅。咁佢覺得係個情形咧都開始恢復正常嚇。咁呢個係個好消息嚇。咁各位觀眾，我哋再休息陣間，一陣翻嚟咧，我請阿 Donnie 再講一講關於我哋嘅健康點樣去得到多啲嘅治療。Donnie going to take another short break, and then when we come back, we'll talk about what are some of your recommendations to us. Thank you. 我哋休息陣間。咁各位，咁今日咧係訪問緊 Donnie 嚇 ，Donnie Nelson 係我哋聖方濟各聖 Francis 醫院同埋聖瑪利醫院呢個舒緩計劃嘅主任嚟嘅嚇。Donnie, so we talked about ACP, we talked about family discussions, we talked about if you have a serious illness, what are some of the treatment, medication, different forms of, care for you, right? So all this, even for me who've been in the community for a while, are hard conversations to have. So what do you recommend the whole community, particularly the Chinese-speaking community, to do? Yeah.
Well, I really feel like people should have these conversations with their primary care clinician, whoever that is. But sometimes just at home, if you find a moment, and you're never going to find that moment, so you have to make time to have that moment. And maybe the question that's started out asking is, if I was ever in the hospital and I couldn't speak for myself, or mom, dad, aunt, or uncle, if you couldn't speak for yourself and the doctor came to me and said, well, what do you want us to do? What would you want me to do? What do you want me to tell them? And what I often find is a lot of times the children don't know. So if we could start those conversations more about just with the question of, if you couldn't speak for yourself, what would you want me to do?
Yep. Okay. 咁啊，Donnie咧就話嗱，呢啲傾偈嘅形式咧，雖然係好難啊嚇，有陣時我哋唐人咧特別係唔中意講關於病啊、嚴重病啊、死亡啊點樣做啊咁嘅。但係如果你喺最好咧就同你個家庭醫生開始因為佢都係你哋嘅醫生，你可以問佢㗎。你話醫生啊，如果第日真係咁樣情形發生咧，我會接受邊種治療咧咁？佢話因為你都唔想話入到醫院先知道嗰啲各種唔同嘅治療嘅計劃嚇。咁啊，如果你喺屋企咧有時間，你一定要有啲時間去諗下呢條題目啦。即係話，如果你入到醫院冇人喺你側跟，冇人知道你想點，你啲仔女又唔知道你想點咧，咁你都要諗下你個決定係乜嘢嘅嚇。咁呢個題目咧，阿 Donnie 話請你哋去 make time， 係真係抽少少時間喺屋企諗一諗點樣去同你嘅家人傾下偈，溝通一下，寫低你哋嘅志願，第日入醫院講俾個醫生聽，講俾佢哋啲主任聽嚇。咁呢個對你哋嚟講咧係應該係好有幫助嘅嚇。So thank you so much, Donnie. So how do patients contact you for more information? Yeah.
Well, I believe they're going to show my phone number. I'm mostly at St. Francis, but I also work at St. Mary's.
Right.
So on the contact is my email address. So if you send me an email, I can send links to you if you have more questions about advanced care planning. But I also have a Cantonese speaker on my team. So if you want to call and leave a message, then we can definitely reach back out to you and then also give you some guidance on about how to do further advanced care planning.
Wonderful. Thank you so much, Donnie. 咁啊 ，Donnie 嘅聯絡嘅方法咧，我哋大家可以喺銀幕度睇到嚇佢最好咧就電郵俾佢，咁同埋咧佢有位同事咧就講廣東話嘅，咁佢如果你打個電話俾佢或者留言咧，佢會請佢同事聯絡你，睇下你哋有啲乜嘢需要，如果有啲咩問題佢可以幫到你哋嘅咧，佢一定會咁樣做嘅。好，咁今日我哋時間亦都足夠嚇，多謝大家收睇我哋節目啦，亦都非常多謝 Donnie 同我哋分享咁多好重要嘅消息嚇。Donnie, thank you so much. Yeah.
Thank you.
Okay.